Comment your name and state below. I'd love to see who's watching and benefiting from these videos. And stay with me until the end, because what I'm about to tell you could help you avoid some of the most frustrating Medicare Advantage problems people run into in 2026. So let me start with this. Every year I talk to people who say, I thought my Medicare Advantage plan was good, until I actually needed it. And honestly, that sentence stays with me. Because it's always the same pattern. The plan looked great on paper, the commercials sounded perfect, and the brochure seemed full of free extras. But once real life hits, once someone needs surgery, or a specialist, or a dental procedure, everything flips. And suddenly the plan they were excited about becomes the plan they regret the most. And here in 2026, more people than ever are walking into these traps without realizing it. It's not their fault. The way plans are marketed makes them look like the smartest choice in the world. $0 premiums, free dental, unlimited vision, it sounds like a dream. But you and I both know there's no such thing as a free lunch in healthcare, especially when the rules keep changing every year. If you're someone who doesn't visit the doctor often, or maybe you only take 1 or 2 basic medications, it's so easy to fall in love with a plan that promises all the extras. But the true test of a Medicare Advantage plan isn't how it treats you on your good days. It's how it treats you when things go wrong. Let me give you a real example. A woman from Florida, let's call her Maria, told me she picked a $0 MA plan because it had dental and a gym membership. She was so excited. And honestly, I don't blame her. If I had just turned 65 and someone handed me a brochure showing all the benefits stacked like a Christmas gift basket, I'd be excited too. But then Maria needed a specialist when her knee pain got worse. And suddenly she learned something that too many people discover the hard way: her MA plan didn't actually cover the specialist she wanted. She had to choose from their list, not her own. And the earliest appointment she could get was 11 weeks away. That's almost 3 months of walking with pain. This is one of the biggest reasons some plans land on the worst list. The provider networks are simply too tight. In 2026, several Advantage plans have shrunk their networks even further because of updated funding formulas and higher costs in certain states. People think the coverage is nationwide, but the networks aren't. They're narrow. They're restricted. And if your doctor, hospital, or preferred specialist isn't in that network, your plan becomes a disappointment overnight. Another major issue that pushes plans onto the worst list is misleading dental coverage. And 2026 is a huge year for dental changes, so pay close attention. The commercials love to scream, comprehensive dental, but when you look deeper in 2026, a lot of plans have quietly changed what comprehensive means. There are more caps, more maximum limits, higher coinsurance percentages, and more exclusions. I saw plans this year offering $2,000 dental coverage, but when you actually read the fine print, only $500 of it applies to major services like crowns or implants, and even those require pre-approval that gets denied more often than people expect. Dental is one of the biggest traps in Medicare Advantage for 2026, especially because people assume they're getting full coverage when they're not. The worst plans overpromise and underdeliver, and dental is usually the first place you feel it. Let me tell you a story about someone named Richard from Ohio. He thought his MA plan covered a crown because the brochure said major dental included. He went in, got the crown done, and everything seemed fine. But then the bill arrived, $1,400 out of pocket. He was stunned. And when he called the plan, they told him something that a lot of seniors are hearing in 2026, your procedure required pre-authorization, and because that wasn't completed, the claim is denied. Richard didn't even know he needed pre-authorization, his dentist didn't mention it, and he assumed his plan would handle it. This is why some plans fall straight into the worst category. They rely heavily on pre-authorizations for even basic procedures. And they deny more than people expect. Another thing that makes certain MA plans the worst for 2026 is the amount of cost-sharing hidden in the plan design. That's the tricky part about $0 premium plans. somebody has to pay eventually. And often it ends up being you, in the form of higher copays, higher coinsurance, and higher max out-of-pocket limits. In 2026 we're seeing more plans quietly push their MOP closer to the upper limit, $8,850 in many areas. That's nearly $9,000 of potential financial risk. And when people hear that number, they usually say, "I'll never hit that." But if you need a hospital stay, or cancer treatment, or dialysis, that number suddenly becomes very real. Let me share another example. James from Arizona was on a Medicare Advantage plan he thought was great. He only paid $50 for occasional doctor visits. Everything seemed fine. But then he had a sudden heart issue and spent 4 nights in the hospital. Under his plan, each day had its own copay, $375 per day. By the time he was discharged, he owed $1,500 just from the hospital stay, and that didn't include follow-up cardiology appointments, medications, or the imaging tests he'd need for months afterward. All of this from a plan he thought was free. In 2026, many plans have raised their inpatient hospital costs again, and most people never notice because they don't look that far down the summary of benefits. Plans that charge high inpatient or outpatient surgery copays end up becoming the worst for people who actually need real medical care. Another huge issue is prescription drug tiers. In 2026, Medicare Advantage plans are adjusting their formularies, meaning the drug lists are shifting. And the worst plans tend to place commonly used medications into higher tiers, where your cost sharing goes up. I've seen plans move drugs like Eliquis, Xarelto, or certain inhalers into tiers with 40% or 50% coinsurance. That means if your medication costs $600 a month, you're paying $240 or more out of your own pocket. Plans that play these formulary games end up costing beneficiaries far more than they save in premiums. And the frustrating part is many people don't find out until January or February when they go to refill their medication and the pharmacy suddenly says, "Your plan no longer covers this the same way." Another reason certain Advantage plans are the worst for 2026 is unreliable customer service. I hear this every year, but 2026 is especially bad. Some carriers cut staff. Some switched call centers. And when you call with a question, especially something urgent like a denied claim or confusion about coverage, you get stuck on hold for 40 minutes, transferred 3 times, and told to check the app. Seniors shouldn't have to fight their plan to understand their coverage. The worst MA plans for 2026 are the ones where people feel ignored, dismissed, or misled when they need help the most. Let me paint a picture here. Imagine you're 72, your doctor orders an MRI, and your plan requires pre-authorization. You call the number on the back of your card. You wait. Then wait some more. When someone finally answers, they give you a different number to call. Then that person gives you another number. And then they tell you the authorization is still pending, but your appointment is in 2 days. You sit there wondering whether you should cancel, reschedule, or just go and hope it's covered. This is exactly what bad plans put people through. Not because they want to, but because they've cut so many corners that the system doesn't function well. And let's talk about out-of-network surprises. Some plans that fall into the worst category for 2026 have introduced new out-of-network charges, especially in PPO plans. People think, "Oh, I'm on a PPO, so I can see anyone." But that's not how PPOs actually work. You can see anyone, sure, but you'll pay much more if they're out-of-network. And in 2026, those out-of-network costs are even higher than before. I've seen plans where out-of-network outpatient surgeries cost 50% coinsurance. That means if something costs $10,000, you owe $5,000. People don't notice these numbers until it's too late. Some plans also made cuts to transportation benefits, grocery cards, over-the-counter allowances, and even hearing aid support in 2026, but they still market themselves as if they provide strong extras. The worst plans are the ones with the biggest disconnect between marketing and reality. They lead you in with the promise of benefits, but they don't deliver them in a meaningful or reliable way. Now, let me give you something really important to remember. The reason certain Advantage plans are considered the worst in 2026 isn't because Medicare Advantage itself is bad. In the right situation for the right person, an MA plan can work extremely well. The problem is when the plan doesn't match the person. When someone with a lot of specialists picks a narrow network HMO. When someone who travels picks a plan that only works well locally. When someone with chronic conditions chooses a $0 plan with high cost sharing. When someone who cares about dental doesn't look closely at what major dental actually means in 2026. This is why I always tell people, don't choose a plan because it sounds good. Choose a plan because it works for your actual life. Imagine a man named Raul in Texas. He's a veteran, he's on several medications, and he sees 2 specialists regularly. A flashy $0 HMO with dental benefits might catch his attention. But in reality, he'd be better on a PPO or even a Medigap plan because he needs flexibility, predictable costs, and stable access to care. If he picks the wrong plan, he'll feel trapped. And that's what the worst plans do, they make you feel trapped when your health changes. Over the years, I've talked to people who said things like, I wish someone had told me this earlier, or, I didn't know I had to check the network every year, or, why didn't the commercial tell me about the out-of-pocket limit? So let me be that person who tells you this before it becomes a problem. If you want to avoid the worst Medicare Advantage plans in 2026, here's what you should pay attention to when you compare options. Look at the network before anything else. Look at the inpatient copays and outpatient surgery costs. Look at the max out-of-pocket. Look at the formulary for your medications. And absolutely look at the dental fine print, especially the caps and exclusions. The flashy extras don't matter if the core medical coverage doesn't support you when you need it. In 2026, some of the worst plans are the ones that cut benefits quietly while keeping their marketing loud. They're the ones people regret joining because they didn't look deep enough into the details. And I don't blame anyone for that. Medicare is confusing, and the plans can be overwhelming. But with a little extra awareness, you can avoid the plans that cause the most headaches and choose something that actually protects you. If you've ever had a moment where you felt unsure about your plan, or something didn't feel quite right, trust that feeling. Ask questions. Look at alternatives. The worst thing you can do is assume everything will be okay just because your plan has a low premium or a nice commercial. You deserve better than that. And your health deserves better than that too. Before I wrap this up, I want you to think about one thing. Your Medicare plan should give you peace of mind. Not stress. Not surprises. Not regrets. The best plan for you is the one that supports your life, your doctors, your medications, and your needs, not the one with the biggest list of extras. If you want more videos breaking down these changes, helping you compare plans, and guiding you through 2026 Medicare updates in the simplest way possible, make sure you're subscribed. And again, comment your name and state below. I love seeing where everyone is watching from. It helps me make videos that actually fit the real challenges you're facing. And whatever you do, don't let the worst plans catch you off guard in 2026. You deserve clarity, confidence, and coverage that works for you, not the other way around.